Lodosyn is used with a combination Levodopa/Carbidopa product to treat symptoms of Parkinson's disease or Parkinson-like symptoms, such as shakiness, stiffness, and difficulty moving. Carbidopa must be taken together with a drug that contains Levodopa to be effective. If used alone, Carbidopa has no effect on Parkinson's symptoms. Parkinson's disease is thought to be caused by too little of a naturally occurring substance, dopamine, in the brain. Levodopa changes into dopamine in the brain, helping to control movement. Carbidopa prevents the breakdown of levodopa in the bloodstream so more levodopa can enter the brain. Carbidopa can also reduce some of levodopa's side effects such as nausea and vomiting. The daily dosage of Lodosyn will vary depending on the individual's condition and response to the medication. It's important to follow the doctor's instructions and take the medication at the same time each day. It's best to take Lodosyn with food to help reduce any potential stomach upset. It's important to not suddenly stop taking Lodosyn without consulting a doctor as it can lead to a worsening of symptoms. Always talk to a doctor about the best timing to take Lodosyn based on individual needs and health conditions. When taking Lodosyn, it's important to follow your doctor's instructions. You may be directed to take this medication with one, some, or all of your Levodopa/Carbidopa doses. The dosage is based on your medical condition and response to treatment. It's best to avoid a high-protein diet while taking Lodosyn, as it can decrease the amount of levodopa that your body absorbs. Also, try to separate your dose of this medication by as many hours as possible from any iron supplements or products containing iron. Iron can reduce the amount of levodopa absorbed by the body. Take Lodosyn regularly at the same times each day to get the most benefit from it. If you experience a wearing off or on-off effect, contact your doctor for possible dose adjustments. Do not stop taking this medication and the levodopa-containing product without consulting your doctor. Your condition may worsen if these drugs are quickly reduced or suddenly stopped. Tell your doctor if your condition does not improve or worsens. Some of the possible side effects of taking Lodosyn include dizziness, lightheadedness, nausea, vomiting, loss of appetite, trouble sleeping, unusual dreams, or headache. It may also cause saliva, urine, or sweat to turn a dark color, which is harmless but may stain your clothes. To reduce the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. In some cases, people taking Lodosyn have fallen asleep suddenly during their usual daily activities, even without any feelings of drowsiness beforehand. If you experience increased sleepiness or fall asleep during the day, it's important not to drive or do other possibly dangerous activities until you have discussed this effect with your doctor. Tell your doctor right away if you experience any serious side effects, such as new or worsening movements you can't control, fainting, vision changes, severe stomach pain, or mental/mood changes. Additionally, get medical help right away if you experience chest pain or symptoms of a serious allergic reaction. If you notice any other effects not listed here, contact your doctor or pharmacist. Before taking Lodosyn, it's important to let your doctor know if you have any allergies to this medication or any other substances. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so talk to your pharmacist for more information. You should also inform your doctor about your medical history, especially if you have liver disease, glaucoma, breathing problems, heart disease, kidney disease, stomach or intestinal ulcers, mental or mood disorders, blood disorders, seizures, or sleep disorders. When taking Lodosyn, be aware that it may cause dizziness or drowsiness. Using alcohol or marijuana can increase these effects, so it's important to avoid driving, operating machinery, or anything that requires alertness until you can do so safely. Limiting alcoholic beverages and talking to your doctor if you use marijuana is also important. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Lodosyn should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It is also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. Remember, it's important to be aware of potential drug interactions with Lodosyn. Talk to your doctor or pharmacist about all the products you use, including prescription, non-prescription, and herbal products. Some products that may interact with Lodosyn include antipsychotic drugs, certain drugs used to treat high blood pressure, and tetrabenazine. Additionally, taking MAO inhibitors with Lodosyn may cause a serious, possibly fatal drug interaction. It's important to avoid taking MAO inhibitors during treatment with Lodosyn, and most MAO inhibitors should not be taken for 2 weeks before treatment with this medication. However, certain MAO inhibitors may be used with careful monitoring by your doctor. Be sure to ask your doctor when to start or stop taking this medication. It's also important to note that Lodosyn may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are taking this medication. Always follow your doctor's advice and do not start, stop, or change the dosage of any medicines without their approval. If someone has taken too much Lodosyn and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It is important not to share Lodosyn with others. While taking this medication, you may need to undergo lab or medical tests to monitor your heart, kidney, and liver function, as well as your complete blood count. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Lodosyn, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. Remember to store Lodosyn at room temperature, away from light and moisture. It's important not to keep it in the bathroom and to always keep it out of reach of children and pets. If you no longer need it or if it's expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. And never flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.